So welcome again to another edition of the Time for Impact. Now you may remember, what was it, a few months ago now, we released a podcast episode with the fabulous, now retired, Mark Lever, the CEO of HelpForce. And although we knew a lot about HelpForce, we had a really great long-ranging conversation, in particular about impact and the power of communities. But there's so much more to HelpForce, and we thought it might be nice, first of all, to invite the new CEO, Amerjit Chohan, in to say hello on the podcast, but also because we think there's so much more around how HelpForce makes a difference to, well, let's be honest with you, helping deliver the priorities and the strategic challenges that we all face in healthcare in the UK. So we thought we'd invite HelpForce back to tell us a bit more. And we don't just have Amerjit here, although you're very welcome, Amerjit. Nice to see you.
Thank you.
We also have Laura Greene, who is the Head of Volunteering and Community Partnership at one of HelpForce's, well, partners, I guess, the Kingston and Richmond NHS Foundation Trust. And not just that, we have Ray Symons, who is a volunteer, I guess, for Laura at the Kingston Hospital. So we've got the full suite from HelpForce CEO to HelpForce partner to volunteer within HelpForce. And there may be some people out there who didn't listen to the Mark Lever episode. I can't believe it if there are, but there may be. Amerjit, would you like to tell us about yourself, but also about HelpForce?
Sure, yeah. No, I listened to Mark's interview, and it was really profound, and I thought he covered all the points around the value volunteering and also the impact. So I'm in post since January this year, and prior to joining HelpForce, I've kind of had a career in the voluntary sector, 35 years, you believe it, and working from a range of organisations. And I guess my kind of initial understanding of what hospitals did around volunteering was when I worked for Imperial Health Charity. And I was there for a couple of years, and we came up with this amazing idea at that point to celebrate the NHS 70th anniversary, and launched a big campaign called the NHS Big 70. And when we did that, we gave birth to some sense to NHS Charity Together, which later on became an organisation that raised £150 million in COVID times. And after Imperial, I went to become chief executive at St George's Hospital Charity, which Ray will know because he was also treated there during his illness at COVID. I learned firsthand actually the value of volunteering. We saw the country turn around and stop and give back as a nation to the NHS, and it was profound. But I don't think we'll ever see that again in our lifetime. And that's kind of what drew me to the role at HelpForce. I knew of HelpForce, I think most people did anyway, even before COVID, and the value volunteering. And so when the opportunity came up, I spoke to Mark, and Mark was retiring, and it just seemed like a good opportunity to step in his shoes and work for an organisation that is all about the value volunteering in healthcare, and not just in healthcare, but also in the broader community. And we're lucky to work with over 100 partners. We've just come to the end of our Back to Health campaign, which has now supported over 1 million people, 18,000 plus patients, 130,000 staff, and 77,000 volunteers. A huge exercise, and one that I can't take credit for. I was there at the end, not at the beginning, but like Laura and Ray and others, they were at the kind of coalface in delivering that program. And we're now at a point as an organisation where we're looking forward. We've just completed our new 3-year strategy, which we'll talk more about our new campaign, which launched in July. We were also a winner of a GSK award for impact, and that kind of focuses on our ability to really demonstrate the value of impact. And those awards are really hard to come by, and we were really glad to be in that situation. And we've just done a big volunteer to career media push, which was incredibly successful. Volunteer to career is all about getting volunteers into a career in the NHS.
And if you were to describe HelpForce in 9 words, how would you describe it?
We basically supercharge volunteering in the healthcare setting. I mean, we don't manage volunteers. We don't have volunteers. What we do know is how volunteers can make impact, particularly in an organisation like an acute hospital, where hospitals are about getting people well and out the door. And the volunteering for them doesn't come naturally. So to make it work, you need to have buying at the top, but also have the right structure in place. And when we bring that knowledge in as an organisation and help hospitals understand that volunteering isn't just a nice to have, it's a must have nowadays. I mean, we've seen it through COVID and we'll continue to see it as the NHS struggles, and it is struggling. I was at NHS Expo last week, and we had a great speech from Sir Jim Mackey, the new Chief Executive of NHS England, and actually Jim was involved in setting up HelpForce 9 years ago, along with Sir Tom Hughes-Hallett. I think there's going to be much more of a closer link with us and the NHS as we go forward. I think, as we've said, we've shown the volunteering works. Now we need to make sure we can scale it up.
I love that idea of supercharging volunteering. I'm going to make a note of that. And when I read your website, for instance, it talks about, almost you providing a consultancy model. So as you say, you don't provide the volunteering, but you provide the expertise, the experience, the data-led evidence that helps, as I see it, partners develop tailor-made volunteering solutions, which is great. And we have one of those partners here, of course. So we should hear from Laura. Tell us about yourselves, but also how you what's your experience and your partnership with HelpForce.
Of course. So thank you very much for having me. So I have a career spanning 25 years in the voluntary sector. I started off as a volunteer manager, having been a Millennium volunteer, so it goes back that far, myself, and giving over 100 hours at university managing a student nightline. And through that experience, I got my first job as a volunteer development manager in the domestic violence sector, and learned very quickly that organisations, be that public sector or a charity, are very resource scarce. And if it's not for the time and talent of volunteers, they will not be able to deliver not only their services, but gain the reach and traction that those services need to reach the beneficiaries that are really in need. So that career followed me through medical research charities such as Breakthrough Breast Cancer, and I landed on my feet when I saw a role in the NHS, which was head of volunteering for what was then Kingston Hospital, which was an acute trust. And I felt like I'd landed on my feet because I had my children at the hospital. I'd been a service user, kids with broken bones to A&E. And I had, through my career in the voluntary sector, understood what it feels like and what it means to mobilise people who are very passionate about health, to lobby their parliamentarians, their local councillors, commissioners, taking every possible route of influence to effect change by telling their story and giving their time for no remuneration to effect change and improvement for the likes of their friends, family, but also the population at large. Yep. So I was very passionate about this alchemy between taking people's time and talent, taking people's personal story, honouring those stories, but effecting change and achieving impact. And I think, kind of about 5 years into the role, HelpForce was established. And from the get-go, I knew that we were going to be excellent partners. HelpForce is an alchemist. They understand the magic formula that it takes to take the raw material of volunteers by way of their time, their personal experience, their own talents, their own skills and expertise that they bring from their careers and their personal lives. But they understand that that is a commodity that you ignore at your peril, and they understand how to create a strategy and the conditions by which you can translate that time into something meaningful and impactful. Not only that, but having set out the programs where that impact is greatest, they then teach the NHS how to measure and generate data that evidences the difference that those volunteers are making. So it is, as Amerjit said, it's not just that nice to do. You are sitting at the table in Fit for the Future planning. You're sitting at the table as a head of volunteering in flow programs, how you mobilise patients through the hospital and back home. And we are, as volunteer managers, recognised as a mechanism of that change, a mechanism to unblock those really pertinent, timely challenges that the NHS is facing and become part of the solution. So yes, a very big advocate for HelpForce, and they've forged a seat at the table that really wasn't there before for the likes of myself as the head of volunteering.
Well, not only are you superchargers, you're alchemists too, it seems.
Absolutely, that's great. Yeah.
I love that. And I concur. Maybe it'd be quite nice, Laura, to hear a bit about what that meant in practical terms. I suppose, first of all, creating the formula that suited to Kingston and Richmond trust and what that looked like. But also, I'm kind of intrigued by this, how the partnership kind of works as well, because it'd be very easily, wouldn't it, for NHS Trust to see HelpForce as sort of interfering or coming along with all the answers and patronising and stuff, particularly, with volunteer managers in the NHS who've got lots of experience. And it'd be very easy to get really protective, but it sounds like that relationship's been anything but that. It sounds like it's been really healthy. So perhaps tell us, what did that look like in practice?
Oh, what a great question. So I think what it looked like in practice is, I think that Kingston Hospital, prior to HelpForce's existence, had the raw materials. So we had a portfolio of 30 different volunteering roles. I had some theory of change training. So I knew broadly the methodology by which you take an activity and you map it through to the impact that you want to see. And then you formulate a data collection evaluation framework to prove your proof of concept. But those 30 roles didn't have a formula or a strategy to sit within. And what HelpForce did with their Back to Health campaign was create these 4 pillars that really followed that kind of NHS principle of cradle to grave, in terms of, if your volunteering is to be impactful, it needs to help people live well. It needs to help people get well. It helped us to prioritize, because the need within the NHS around improving services and improving patient experience is infinite. It never ends. And so how do you know, when you've got finite resources, how to prioritize people's time? If they're giving it for free, how do you know where to put that as a resource? So I think, firstly, rather than being bothersome and kind of intrusive, HelpForce helped with that resource prioritization by giving the sector a very clear sense of leadership about where this time will have greatest impact. So that's the first thing that HelpForce brought to the table. I think in terms of partnership, how it works is you come to HelpForce with a concept, or they generate the concept. So, for example, we already had at Kingston Hospital the community exercise volunteering program. HelpForce saw the magic formula at work, but their point to us was, how can you scale this, and how can you make the business case to scale it if you don't have the data to underpin it? So that's where the partnership was effective, that they spotted the opportunity and they posed the challenge and said, this is good work, but you don't want to run this as a cottage industry. If volunteers are preventing deconditioning, and if volunteers are improving transition between hospital and home, then we need to do this. We need to do this at scale. We need more than proof of concept. We need to scale this to multiple NHS trusts so that this becomes the norm, and that patients on a pathway between hospital and home have volunteers alongside them at every touch point in that pathway to support their health outcomes and support their well-being. So the partnership was really about having expertise, HelpForce having the expertise to give, and the organisation, Kingston and Richmond NHS Foundation Trust, having the openness to be taught how to measure your impact in a methodical way, and also how to shout from the rooftops, how to engage your CEO, how to build the business case, so that when you're talking at the table about the money, or you're talking about the engagement, or you're talking about this being a wider than just your trust, this being a place-based responsibility. How do you engage your local authority to take this on board? How do you engage your local ICB to take this on board? They just really gave us the voice to amplify what we were doing at the coalface and get it acknowledged, funded, resourced, and sustained at scale.
It seems to me that sort of impact piece is so important as well. Lots of organisations have involved volunteers for a long time, and many of us can be guilty, I think, of sort of going, well, we know it works because we see it working, or we know it works because we've been doing it for a long time, or we know it works because we keep getting more volunteers, or we keep people coming back to us. It feels like in 2025 and beyond, in the world we're in now, and particularly when it comes to the NHS, like, this notion of impact doesn't seem to be just about demonstrating things work. It doesn't just seem to be about unlocking funding. It also seems to be a real evidence-based key way of solving problems in the NHS, and making a case for doing things in a certain way, which is so important, right? Like, if you've got a limited resource, if you've got to be as efficient as possible, if you've got to make tough decisions, it's much better to make those tough decisions based on evidence and insight, rather than the gut or the half truths or half facts about things, right? It feels like increasingly that kind of case is so important.
And you're right, Matt. I think that the whole emphasis now is around showing impact, and whether it's cost benefit. We can prove, and Laura knows this, that by supporting patients through a discharge process, getting them out and home, saves money. It gives beds back to the NHS. And we know those beds will be taken up overnight. There's always a flow of patients, but there is a cost benefit there. And if you can demonstrate that and demonstrate it well, then it makes it easier for those hospital foundation trusts who are under huge pressure to save money, huge pressure. Cutting volunteer service isn't the way forward. It's actually going backward. And I think that we can show that across all of our work, and that's something that we're proud of. That our impacts and evaluation services is probably one of the best I've seen in the voluntary sector. And across organisations that are much, much bigger than us. You've got to remember, we're not a huge organisation, headcount of 20, but our impacts, we're punching above our weight all the time. And I think that's what makes us nimble, agile. And as I mentioned, and you've probably heard, there is huge changes taking place in the NHS at the moment. Within 2 years' time, NHS England won't be here. Department of Health and ICBs are going to merge. So there's a lot of pressure, financial pressure, across the whole range of services. And I think what we're trying to do is influence the 10-year plan to make sure that volunteering does feature. Because I think if it does, then it gives us more scope for growth. But if it doesn't, we'll keep pushing.
Yeah. And I really want to come back to the 10-year plan, and I'm sure we will as well. But I also wanted to close the circle in terms of how Ray feels about this. Well, you tell us your motivation for getting involved and how it all fits in with HelpForce and with the trust.
Well, my motivation is very straightforward, really. I found myself in a position of being very unwell 5 years ago, and it's no exaggeration to say that the staff collectively at Kingston Hospital and then St George's saved my life and put me back on my feet again. And so for me, very quickly it became important to demonstrate some sort of tangible gratitude for that. So I decided to put my name forward for volunteering. I think the thing that really continues to motivate me now is that when I go in, especially when I go into the wards, I see people who are in a very, very similar position to the one that I was in. And although the health professionals know what to do to make people better medically, most of those health professionals are young, fit, healthy people. So they may have never been on the other side of the bed, so to speak. And I feel that one of the things that I can bring to the shows is an understanding of the experience of the people that are in the beds, because it can be a very lonely and isolating place, and being able to interact with somebody that kind of knows what they feel. I can see from their reaction that it's a really beneficial thing to do. And the great thing about HelpForce and the whole volunteering setup at Kingston is it provides a very clear and very structured way in which I can interact with people.
Yeah, I was going to ask you that in a sense, because clearly your motivation is really clear and lots of people can relate to that. But sometimes, we're talking about impact and so on. But actually, what you're saying is that the structure and the evidence base actually makes a difference to you as a volunteer, because you can see.
Yeah, I mean, it gives me a really clear framework within which to operate. That's been there. The exercise program in the hospitals on the wards has been there since day one, and I found the structure for engaging with individual patients on a one-to-one basis very helpful. The thing that I really liked about it is for the home visits. Is right at the very beginning, you have a meeting with a professional and also your patient, where you discuss your priorities and the objectives for the 8-week program that we work with them. And that's really, really good. It's really great to have that kind of focus. And me being me, it probably wouldn't have occurred to me to do things that way unless I was kind of dropped into a framework where I was guided through that kind of process.
There's also something about getting the voices of volunteers who, in your case, of course, you've been a patient as well, so you've got a double kind of lived experience, but also even volunteers who are working with patients in hospitals are often closer to the action, if you like, to the people's real genuine needs than us
Yeah.
professionals ever can be. There's something, and I'm hoping Laura and Amerjit would tell me, there's something about capturing and enabling that feedback loop from yourselves as volunteers, both on the day-to-day, but also in developing the services that exist now, developing new services, and also evidencing what works and what doesn't. Hopefully there's a good feedback loop that's working, which is built on lived experience.
Yeah, so if I could come in on that, that's something we've given a lot of thought to over the years. Right now we have because volunteers are the eyes and ears of the hospital, and patients will disclose things to volunteers that they don't disclose to staff, or volunteers will observe behaviours or interactions between families and different familial systems that need to be escalated. So we try very hard to empower volunteers. So the mandatory training day begins with a welcome from a member of the executive team, who will always state, "My door is open, you are the eyes and ears of the trust, and your feedback is vital." And we always say never leave the trust knowing something about a patient or a staff member, or having witnessed something that is not the exemplar of outstanding healthcare. If you see something that you wouldn't want for your mum or your grandma or your brother or your sister, you need to disclose that so that we can deal with it in the here and now. We can nip it in the bud before it becomes an issue to escalate, before it potentially becomes a complaint. So I hope that, and Ray can hopefully attest to this or dispute it, that volunteers have that open door to any uniformed member of staff, any member of the SLT, myself as head of volunteering. But on the other hand, we're a small team. We are 64 whole-time equivalents, supporting over 500 volunteers. So we had to have more than that immediate kind of feedback mechanism. We had to have something more robust to continually learn from volunteers, and also close the loop so that volunteers knew what we were doing with their feedback and acting on it. So we now have, every volunteer will have access to a QR code. They are encouraged at the end of their shift to click onto that QR code, give their feedback, and we monitor that in real time. So we have a "you said we did" mechanism, by which if volunteers tell us that corridor care isn't working, that it creates a health and safety risk, that trolleys are clashing with dirty linen trolleys in A&E, we will go there and we will floor walk with the senior matron in A&E or the ED department, and we will rectify that with quick wins, and we will put it onto the trust risk register for long-term scrutiny. So I'd say that we have had to learn over the years not simply to listen and then that's where the process ends. We've had to really create a much more robust way of listening. And then, as Amerjit said earlier, I can't remember the exact figure, but something like 77,000 volunteers that their work has touched. The insight that those people bring to our public service for improvement is extraordinary, and we have to we ignore that at our peril, because that is gold dust, because it's things that patients are disclosing, it's observations that our volunteers are making that simply would not be picked up elsewhere.
And locality is everything, I imagine, as well, and that's, I guess, the next level up is a challenge for you, Amerjit, and the team, is because you've got some really great trailblazing programs. I'm sure we'll talk about volunteering to careers, etc., and you need to get the fine balance of having a good blueprint that can be taken and shared elsewhere, and so and to keep relearning the research and development everywhere we go, without providing widgets that don't fit in every local scenario, and that's where partnership comes in.
Yeah, no, exactly. And you've got to remember that every hospital in the UK is an anchor institution. They are the largest employer in your locality by far. I mean, the NHS, I can't remember, is it the fourth or fifth largest employer in the world? So you've got to get the workforce right, and to support that, you've got to get the volunteering right, because the volunteering can also be part of the workforce. And you touched on the volunteer career. For us, it's something where we've trialled 80 trusts, and 800 people have gone through volunteer career. 70% of them actually working now, and majority of them actually working in hospitals. And the reason why we were so keen on volunteer career is that it gives people an opportunity to try before they buy, in a sense. You're not sure whether this is going to work out for you. We've had people who've change mid-career, to work in the ambulance crew. We had a roofer who now is a paramedic. We've had somebody who's worked in finance who then went to be a midwife. These are all things happen because they can volunteer in that space. They can learn, they can understand, and all of them actually have I'd say majority of them have a link to the hospital. It's not just that they want to go and change career; they want to give back as well. We talked about giving back as being the main emphasis. It is for most volunteers, as is for Ray. There's always a story there that brings them back into that healthcare space. But as we've said, the volunteer to career is a great opportunity for people to work in an institution, and also those furthest from the workplace, unemployed, disadvantaged, refugees, veterans. All of these individuals have a part to play in our NHS. I mean, our NHS is a broad church made up of many different individuals across many different religions as well, and that's important because it reflects the healthcare of the nation. And we've got to keep supplying that, and that's why we're keen that we've got traction now, volunteer to career, to make it something that is scalable. We're talking to a number of partners about scaling it up. We want to see every Foundation Trust. The costs for vacancies in the UK for the NHS is 10 billion. And that's huge. Imagine how that could be spent elsewhere. So, if we apply that expertise, we can bring in those local people, we can train them up, they can go through a volunteering program, and they can end up working in hospital. And for some of those people, hospitals are scary places. They're almost like going to university. And if you're not educated or haven't had an education, going into that space is daunting. Again, I think volunteering is a great route, and as Laura has mentioned, it's an incredible way to get people into the workforce.
Nice sort of taster session, date before your marriage, whatever your analogy might be.
It could be the new dating app.
Yeah, it's that's a whole other podcast, dating and volunteering.
I think it's a really good way round of like reminding us all of that, like, benefit of volunteering to volunteers, right? Like, I think often the dialogue about volunteers and volunteering is people sharing their skills like with others. And I think we don't often talk enough about how volunteering develops people's skills or develops people's experiences or unlocks the things that were already there to put them on the right sort of path or trajectory, which is right for them. There's I guess sort of coming back to Laura's point about there's the sort of the alchemy for the organizations, right? But there's the alchemy for individuals as well, which is, helping them get on their route. It's this thing about dual benefit, isn't it? Like if we get this right and we structure programs in the right way and we think about this in the round with organizations, with people and what everyone needs, then we can have a win-win-win kind of situation. Mm-hmm. And I sense that's a really key part of HelpForce as well, which is about going, okay, that consultancy model really seems a key one, which is like, okay, how do we make this work here in this context with this group of people in this setting? We know this concept works, and now we need to unlock it for this particular community or this particular trust or whatever.
I wanted to give credit to HelpForce where it's due. I think I've done 6 different evaluations as a trust alongside HelpForce as their partner. And in every single one of them, whether that was dining companions, community exercise, whether it was ED volunteering, they made a point of having an outcome which was around volunteer experience and the impact for the volunteers as an individual, whether that have been development of new skills, whether that have been the satisfaction of giving back, and to really do some discovery and exploration as to what volunteers were receiving. It's that your point around reciprocity, and that it can't simply be a one-way currency. So credit to HelpForce. I think they have explored that very thoroughly as an outcome. And I also wanted, if I may, to come back on again, credit to HelpForce of getting involved in actually lobbying the thinking of the NHS 10-year plan, because we talked about localism, and that really is one of the objectives, and the thinking for the NHS within the 10-year plan is that services will move from acute into localities, into neighbourhoods even, and that's where the resources are going. And somebody like Ray doing the community exercise programme and doing the home visits, actually that's the most innovative, cutting edge thinking around delivery of healthcare services in action right now. And so the NHS is looking for innovation, it's looking for lean solutions to known problems. And here we have Ray having a cup of tea with somebody in their living room talking about their goals to prevent deconditioning and to get stronger and to get back into their garden. And ultimately that's where health improvement takes place. It is in the home and it is in neighbourhoods. And I think that is going to be a really interesting conversation when the NHS plan is published, is around how does HelpForce retain that sense of locality, which is now a priority for the NHS, whilst kind of lobbying and being a movement for exemplar NHS volunteering. I think we almost, as a sector, NHS volunteering has got there first, and programs like community exercise, force prevention and other home-based interventions, that is the direction of travel for healthcare.
I think that localism bit's, it's a really good point, and it's going to be really interesting because I think, Chris and I talk about this a lot on the podcast, but like that localism seems to be also where volunteering is strongest as well, right? It's, the community providing support within communities for their communities, people, knowing their community best, knowing what their community needs, people identifying problems and solving problems within their communities, like all of that sort of hyperlocal activity is kind of where kind of volunteering has been for a long, long time, I think, and long may it continue. And we get in the way of that at our peril a little bit, like actually harnessing that feels like a real opportunity with some of this, I guess.
I would agree. A huge opportunity. And people like, Ray with us today, as a community exercise volunteer, he is alongside the patient at the bedside, in the hospital, at their point of transition home. He's there in their living room, making a cup of tea, talking about the effects, the harms of being in hospital. How is that patient deconditioned? What are their hobbies and interests? What could they do before their hospital admission that they can't do now? And what goals do they have for getting back to that sense of normality? And this is absolutely the direction of travel, within the NHS 10-year plan. And I think it's absolutely right for HelpForce to stand in Parliament and lobby parliamentarians and other stakeholders to say volunteering is hand in hand with community-based healthcare. I say we, Ray, all the volunteers that we support are the people that hold the hand of the patient wherever they are receiving their treatment, whether that's in the acute hospital or whether that's in their living room. It's the volunteers that have that reach into all aspects of healthcare. The clinician only sees one dynamic and one environment. The volunteer actually has access all areas. And something like the community exercise program, I think is, again, I keep using that word, but it's the exemplar of where healthcare is already going. And HelpForce have been banging the drum and showcasing the impact of those hyper-local volunteering roles that are transforming people's lives.
When I saw this sort of local elements appearing in the NHS 10-year plan, my initial conversations with people in NHS trusts, things like non-executive directors and directors and stuff, there were some of them were a little bit really agreed with it, didn't know how to go about it. So it's really useful that HelpForce is actually providing some blueprints to do exactly that, so they don't have to reimagine it themselves.
Yeah, and I think it has to happen. And one of the things that will feature in the healthcare plan, 10-year plan, will be about healthcare in the community. We can't continue to rely on hospitals providing that care. That's the end of the road, not the beginning. Health deterioration happens at the home or when you're in your life settings as well. So there's a bit of self-awareness around how can you manage those yourself, but equally, what can we do better in care in your home or in your community? And the one thing that we know is that there are 3 million plus volunteers in the community and 77 or 80,000 in the NHS. So there's a big difference. And I think that the challenge we have is how can we coordinate those organisations to become more localised and understand the challenges. And the other barrier that we'll always have is funding. That there is no, I don't think, it's unlikely that the 10-year health plan will deliver any more money. We know that the NHS had a 3% uplift. That's all that's going to happen. And we know that organisations are going to have to trim their budgets. But I do think, and I do believe that volunteers will continue to play a part in healthcare in the community. It's the only way that it's going to really work. And I think there needs to be more cohesion around how that's going to function, hospitals, and about how they can work more in the community. And some do better than others, but it's not all the same. And I think there needs to be more direction around that. We've written to a key number of authors of 10-year plan. We've written to key contacts West Streeting about the value volunteering. So we've yet to hear what the result is, but I am hopeful that whatever does happen, that volunteering will be a key element of future healthcare.
It's certainly something I'd like to see more of in planning and policy from government. I think sometimes it's seen that wouldn't it be great if there was a distinct kind of volunteering plan for the nation? And I think that's an interesting conversation. And I think investment in volunteering and focus on volunteering in that way is interesting. But I also passionately see volunteering as something that is threaded through everything we do. It's threaded through the NHS. It's threaded through the way we help people get jobs and careers. It's threaded through the way we support young people to develop skills. It's threaded in all different kinds of ways in society. And my view is that therefore volunteering shouldn't necessarily be this extra thing that kind of sits over here. It should be part of the way we do things because it already is part of the way we do things. sort of locally and nationally. And the more we can support and develop that, the better, I think.
And neither should it be the cheap solution to skills shortages in the NHS.
Can I make I'd like to make a point on that, especially about this whole idea about the role of the volunteer. I very strongly agree that volunteers should not be a cheap replacement for skilled labour in any context at all. And in fact, and one of the reasons why I say that is because when I go and volunteer, I see what I do as something additional, something that wouldn't otherwise happen. So I haven't got the burden upon me of having to make sure that I see a certain number of patients during the round. And what that enables me to do is if I have an interaction or a contact with a patient that's kind of going somewhere and they want to talk and they want to spend a time, I'm quite happy to spend 30 minutes, 35, 40 minutes with an individual patient, because I know that I haven't got to fill a quota or meet some criteria. And that's really important to me, the ability to provide what I consider to be a quality service or a quality input to somebody's time in hospital. That's a really important factor for me.
And I think it's important as well, Ray, isn't it, that sometimes the best healthcare solutions, and I'm saying this as a non-healthcare professional, but sometimes the best healthcare solutions, the best solutions for people's healths aren't always clinical. And I think it's very easy. Matt and I have both worked in health charities before, and actually it's very easy to think that the answers to all things are clinical solutions. But actually sometimes the innovations, they're all cost savers, in fact, are actually not just the clinical solutions.
I have seen Ray's empathy in action, and I think we talked earlier in the discussion about humanity and humanizing healthcare, and you can't put a price or a value on human to human connections. And I have nursing colleagues who've told me that they know that a patient is trying to make eye contact with them, and they will actively decide to look down and scurry on, because they know that that patient needs some support or has a request to make of them, and they don't have the time to listen and enact the response. Is that actually frugality where they're getting on with the tasks, but in delivering the tasks, you have to suspend a little bit of your compassion? And volunteers bring that in abundance. So I don't think we can underestimate the power of people helping people. And actually, as we've talked about, the solutions don't always have to be the most convoluted, expensive, complex, system-led solutions. Actually, sometimes people helping people, as right at the outset, Amerjit was talking about the origins of HelpForce and this kind of boom of civic society during COVID. I'm not sure, as he said, that we will ever get back to that, but there is something really important about remembering the simple component of volunteering, which is people helping people, and bringing it back down to basics of common decency and humanity.
You're right. I mean, that ability to give the time when clinical staff time is so stretched, it's a huge value. We've had volunteering services that run handholding, which is end of life. Being there with somebody when they have an hour or 2 hours to live, and you can't get clinical. It's impossible to get a clinical team to do that. My parents passed away in 2018. Actually, my father died on his own in hospital, and that taught us something. When my mother became ill, we brought her home. And that end of life was with her family, and it made those kind of things make a huge difference, because those times are really precious, and as individuals we don't want our loved ones to be there on their own at the end. So I think the power of volunteering is huge if done in the right way, and I think, Laura, you're talking a lot about the services you provide. It's you're exemplary in terms of that kind of provision. Not every volunteering program is there, but that's where we want to change those kind of experiences for volunteers and make them more impactful and more powerful.
I wondered, picking up on the theme of impact, there's some quite specific interventions that HelpForce are kind of supporting, looking at, or problems trying to support the solutions through volunteering, right? And I think one of them is about trying to speed up patient discharge. I'd be really interested in how that's working or how that works. I've had a close family member in hospital recently. I sort of know firsthand the challenges of discharge process. How's that working with volunteers and with HelpForce?
Shall I kick off first of all, and then you can give the hands-on experience? Patient discharge is complicated because you're relying on so many different variables. The most important one is the individual going to be supported at home, and this kind of plays over the whole kind of social care problem we have, where more people living on their own, more people elderly. You can't discharge someone to a home environment that's unsafe, so they will stay in hospital until that problem is dealt with, and that sometimes can be weeks, if not longer. And the longer an elderly person stays in hospital, the more muscle wastage they'll get, and the harder it will be for them to integrate back into normal life. So that's one element. The other one is just a simple thing like getting patients the right medication. So they can actually leave, because you can't leave a hospital if you have medication. You've got to get the medication to you, and then the consultant has to sign you off. So all of these are problems that we can deal with and have dealt with. Even getting patients transport home is again a challenge. If you don't have family picking you up, you may rely on local transport, but again, is that going to be sufficient for you? So these are all the elements where volunteering has played a part.
I was going to ask you a question about how you go about influencing the big picture, the big NHS plans around volunteering.
We're a small team. We're not, we don't have a policy team. We don't have those skills. So we use our networks. We have a very influential group of trustees who are also part of the NHS. We have Karen Bonner, Chief Nurse for London. She's incredible. She's a great advocate of ours. And we can find ways or routes to the key influencers, whether it's Department of Health or NHS England. As I mentioned, with Jim now being in driving seats, it probably makes it a bit easier to have those conversations. I'm not saying we'll get a chat with Jim because he's going to be too busy, but we can at least make those calls and send those notes to him to say, look, this is really important. Volunteering needs to have the endorsement, but also potentially the funding, and to get us in the space where we can then ultimately have a conversation. And we met with Karen Smith, Minister for Health. Our hope is to get a conversation with West Streeting, but these things take time. But as I said, it doesn't stop us from trying, and we will continue to push this. We have a lot of supporters. We also have good relationships within the health service. So it's about using your means and your knowledge and your networks to make that influence.
But I'm kind of intrigued. So, I have this picture in my mind of you flicking through the NHS 10-year plan going, I can help with getting more people fewer people to miss their appointments in hospital. There's a solution here for NHS for volunteers to get involved, or community outreach is a solution here for volunteers. The Secretary's plans to divert funds from hospitals to primary care and into communities. There's a role here for volunteers. I have an image of you flicking through the plan and coming up with these things. How do you actually say, this is where we're going to target our priorities?
We've been around now for 8 years. We've got, as Laura mentioned, we've worked with over 100 partners. We've done hundreds of pieces of evaluation. We know what works. We know what has impact. And we're applying that knowledge now in the next 3 years of our strategy. Focus will be around supporting discharge. It'll be around reducing DNAs, but also volunteer to career. DNAs is a huge cost to the NHS. Patients missing appointments is happening all the time. And it's not because patients want to miss appointments. Sometimes they'll get a letter inviting to appointment after the appointment date, yes. Or they'll have problems in getting to the hospital, or they'll have care issues with children, or their English may not be their first language. There are a multitude of issues and problems we can deal with, and that's what we're doing with our program around DNAs, where we're using volunteers to call patients, those we know that are at risk of non-attendance, and trying to find out whether we can support them in getting to hospital or rearranging the appointment that best suits their needs. And it works. If we can reduce that by 10%, the savings are huge. And it doesn't require huge resource. A couple of volunteers in a room with some numbers, that's basis of what it is.
I can absolutely vouch for the impact of volunteering to reduce non-attendances. So in our pelvic health physiotherapy service, their DNA rates were 5.8%. And 3 months after the introduction of kind of phone-based volunteers reminding people about their appointments, troubleshooting, helping them to arrange transport, that reduced to 3.8%. And that translates into X number of patients, and I think it's £120 cost to the NHS per missed appointments. It's economies of scale, isn't it? When you do that across the NHS, that saving is not just £120, it's into the thousands and millions. And just going back to discharge support, with HelpForce's support, we evaluated our discharge support volunteering scheme, and we're kind of surprised and equally delighted to learn that with the help and support of a volunteer going home from hospital, that patient is 16% less likely to be readmitted within 6 weeks than a counterpart of the same age, the same health condition, the same presentation, who had not had that transitionary support through the volunteering scheme.
What we would like to do is roll this out and see something that's national in making sure that those patients who probably, if the appointment is missed, the chances of risk for them is greater, and those healthcare conditions can get overlooked as well. So those problems are a cost, but those costs are only going to get larger. And as I said, the waiting list numbers are astronomical at the moment.
So we've explored the amazing. I'm not just saying that, the amazing impact that HelpForce as an organisation and volunteers have on shaping government plans, hopefully definitely delivering on government or helping the government deliver on NHS plans. We talked about the partnerships that HelpForce forges with NHS trusts and others up and down the country, and providing that sort of consultancy model and advice, and the impact and evaluation and stored up knowledge that you have. And we've explored some of the roles of people like Ray and thousands of others of volunteers across the country who are individually alone making an incredible impact, but collectively making an enormous impact on UK PLC, UK society as a whole. So maybe I'll ask all three of you to say, if you just one sentence on what you think the rest of the voluntary sector must learn from the HelpForce experience. What's the takeaway for all our listeners, both in the UK and overseas, well, most of which are volunteer professionals, that you would recommend that they learn from your HelpForce experience?
I think for me, the key takeaway is you've got to be able to demonstrate and show the impact of volunteering, not just in numbers, but also in cost-benefit analysis. That's when people sit up and listen. They'll understand the value of volunteering and the difference it can make. But also it doesn't take away from those amazing human stories like Ray and others who do amazing things on a daily basis. Volunteers are just a reflection of our community, and they make up that broad spectrum of people who want to give back and love their NHS. And I think the point, is that we've got to continue pushing that. We've got to continue messaging and just show that volunteering is here and is of value.
So I think I'd echo Amerjit's point, really, that 20 years ago when I started in the voluntary sector, we knew we were doing the right thing. And if we shouted loud enough and told people we were doing the right thing, that they'd sit up and listen, or there'd be funding available. But I think we've come to a point now with such austerity and scarcity in the NHS that narrative is not enough. It is not simply enough to say we do this because it's the right thing to do. We now have the evidence to say we do things because we know it works. And we do this because we know it avoids harm. It's an efficient, lean and cost-effective way to augment services that the NHS is, mandated to provide. So I think in terms of what people can learn, it's about moving beyond the narrative, getting your data in order to talk the language of impact. And that's what gets you a seat at the table. And
it feels only fitting, Ray, that we give you, the volunteer, the last word.
Right. I would say that the thing that I've learned from the Workforce programme is the benefit of having a structured and consistent approach. One-off interventions or one-off interactions might do something to temporarily lift the mood of a patient for a short period of time. But if you want to have long-term benefits, you really need to have consistency of engagement over a period of time.
Brilliant. So that structure and that consistency is key.
Yeah.
Well, thank you all ever so much for joining the podcast. Listeners won't know because they'll listen whenever they want, but it's 5 to 9 in the evening. We've gone way over and beyond the call of duty, both for staff and volunteers. I really appreciate it on a very hot, sweltering summer's evening. Yes, in the UK, a hot, sweltering summer's evening. And so thank you for joining us. I'm sure there are loads of really great takeaways. Certainly Matt and I have taken them away, and I'm sure our listeners will ponder what you've had to say and think what it means for activity in the future in their own organisation. So thank you for sharing your story.
Thank you. Pleasure. Thanks.
So 3 excellent panelists, all with different stories to tell or with different things to say about volunteering, but definitely all focused on this idea, which I really liked, of supercharging volunteering and really maximizing on impact. What's your thoughts, Chris, on the three people we spoke to today?
Yeah, absolutely. We knew from the conversation with Mark that and our own interactions with HelpForce, they're always really strong on the impact story. What I liked about hearing today was taking that one step further in terms of applying the data, the intelligence and the experience that HelpForce has gathered over many years now, and certainly many situations, and really intelligently applying that in a kind of consultancy model with different partners, being adaptable to local circumstance, but actually bringing the power of that research that they've done before to, as I think Laura called it, to build that sort of alchemy in volunteering. And I liked the way when she talked in particular, I was quite taken about how, she's obviously a very experienced volunteer manager in her own right, but having the backup of HelpForce enabled her to elevate her volunteering and her management within the NHS context much higher than perhaps she could have done alone.
It feels like, for me with that, like there's real benefit in this notion of sort of proving something works and starting with impact, starting with the difference you want to make, building the evidence base, and then sort of extrapolating from there. And it's almost like you've got this consistency of impact, flexibility in sort of application. And that can be, I think, for those of us that kind of have a role in leading volunteers, that can be really helpful, because often we're really in the weeds of the delivery and the operations and the how and the mechanics. We know our organizations, or we know our volunteers, or we know our local context. But what we sometimes miss, or what we sometimes don't have the opportunity to get to with being in all of that operational weeds, is taking the time to evaluate and measure and really understand the difference beyond kind of superficial we know it works pieces. And to HelpForce, who've totally flipped that on its head, they go, well, actually, we're the experts in evidence and frameworks. Like, we'll help you know what's works, but you're the expert in your local context. Why don't we put these two things together and make the magic happen, sort of thing, which sounds like a perfect mixture for me.
In many ways, it's very similar to what we do as consultants in going into organisations. Often I speak to volunteer managers who, are the most brilliant people, and actually probably really get impact and data, but don't have time or the headspace to move away from firefighting to really think about impact. And you do need to build impact in from the start of your organisation or your strategy. Even actually use impact to, understanding the impact you want to measure when you're writing your volunteering strategy is really, really key. So many volunteering organisations don't have the luxury of time or headspace to really get into that. So to have someone like HelpForce in your corner who can help to build that in from the start, but not just that, building experience from other partners to build that evidence base is even better, because even if you're really the best impact measurement volunteer manager you can get, you can only measure what happens in your own organisation. You can only take it so far. To be able to leverage the data and the intelligence from other NHS trusts is a real boon, in my opinion.
Yeah, absolutely. And I think what's interesting as well is they seem to have really taken this evidence impact-based approach to establish a real clarity of the problems that they can help people solve. And those problems are real problems. Like I don't think anyone that spends any amount of time in the NHS will see those problems like very, very, very quickly. They're not below the surface. They're right in front of our eyes. And, my experience of NHS sort of recently is lots of people working really hard, trying to do their best, clinicians trying to do their best. But that resource can only go so far. It can only operate in a certain way, and yet these problems persist.
And HelpForce to put volunteering right at the centre of solving those problems, not a periphery, but at the centre.
Yeah, and enter the local community, which is volunteers, right, who are there again to solve to be part of the solution to those problems, which I think is great, because that's what's happening in all kinds of other spaces. Why is the why would the NHS be unique around that? Volunteers are tackling all kinds of other community-based challenges. When the community comes together to solve problems, they're powerful. And again, we're seeing that in NHS settings, right? And enter an organisation like HelpForce to supercharge it all and make it happen and convene and bring all the key players together to not just sit there worrying about the problems, but actually bringing all the pieces together to solve them and make the action happen. I think it's brilliant and really valuable.
Not just talking the talk, walking the walk.
Absolutely.
For sure. Another great episode. Some great guests. On to the next one. Thanks again, Matt. Always good to chat with you.
Thanks, Chris. Look forward to it. Bye-bye.
That'll do us. Hello everyone again, it's Chris Wade. Just a quick note to say that HelpForce have asked me to mention their Giving Back Transforming Care strategy that they just launched. It's a 3-year campaign designed to inspire national conversations, focus deeper public engagement and shift perceptions of healthcare volunteering from a nice to have to a strategic imperative. Well, I mean, at Time for Impact, why would we not want to support and get behind such a call, particularly when their headline features are calling for greater investment from NHS organisations and from government and philanthropic bodies and funders and so on into healthcare volunteering infrastructure and into raising the awareness of the impact that volunteering has, something very, very close to our hearts at Time for Impact. So I'll put a note to the campaign in the show notes. Please do take a moment to check it out. Until next episode, thanks for listening.